We know that there has been a lot of talk and a lot of reporting about the shooter having Asperger's syndrome.
Right.
First of all, we want to ask you, since you are the clinical psychologist who is an expert, world-renowned expert in this field, what is Asperger's?
Right. Well, and we have actually touched on this a few times in our show before. You know, Asperger's is currently on the spectrum, or considered to be on the spectrum, and really it has to do with individuals who have delay in social aspects, but not necessarily language or communication. And you know, with autism or with pervasive developmental disorder, PDD, what you're looking at is a series of delays in both language as well as social behavior. But with Asperger's, really it's more focused on the social. And you know, having said that, what does it actually look like? Well, our kids with Asperger's, first of all, it's very difficult to actually accurately diagnose Asperger's when it's a very young individual. When you get a little bit older, it becomes a little bit more obvious. And the reason is that certain very, let's say, the nuances of social behavior don't even develop until age, let's say 6, 7, 8, and so on. So you're not, your deficits are not even obvious until you're a little bit older. So what are these? These are things like, and we've many times talked about, all the cognitive areas. For instance, not being able to understand people's perspectives, not being able to understand your own or other people's emotions. All of those types of things, and then as a result of that, as you get older, it leads to problems with understanding how the social norms are affecting you and how your behavior affects social norms. What is okay, what's not okay, how do I actually become a popular kid, let's say, or how do I gain friendships, how do I look cool, all of these types of things, you know. And assume that you have someone who's going through that developmentally, and again on the individual in Connecticut, it hasn't been identified for sure if this person had Asperger's or not.
No.
But I mean, as you know, Nancy, a lot of times we have people who have aspects of Asperger's, and they've never really been diagnosed.
Never diagnosed. Many of them living out there, and let us note, many of them highly successful individuals. Oftentimes, I said, is just as probably more common for an individual with Asperger's to develop the next cure for cancer rather than be the next mass murderer. Right?
That's right. I mean, sometimes you have, I mean, we used to have someone working in one of our departments here who absolutely clearly had a diagnosis, and he was one of the strongest people in that department because he had an amazing memory. So you have to understand that with Asperger's, like with anything else, you have these social deficits which are very sort of abstract, non-rule oriented behaviors, but at the same time you may have developed significant strengths in other areas. Math or engineering or statistics, just memory type things and so on. So yeah, we cannot think of our folks with Asperger's as being kind of you know, mentally retarded or anything like that. In fact, most of the time they have extremely high IQs.
And wouldn't you, I'm sorry Shannon, wouldn't you even say that they go out of their way to avoid conflict with other individuals, most likely, more,
so let's
more
actually
likely
talk
to
about
retreat?
This. Right, and this is actually kind of an interesting, important focus, because I think our fear, I believe, is we don't really want the world at large to think about our spectrum as dangerous. We don't want that to happen, and it shouldn't happen. But so I want to explain this a little bit. First thing is, how do we even explain any individual on or off the spectrum? Has nothing to do with it. How do you explain the behavior of someone who does something so horrific? Right? We can't. Right? That's why we're all left in shock, because we sit there and we think, nothing justifies this. Like, there is no reason that would make this okay. Right? I mean, so having said that, the process, what I think happens with a lot of our kids, Asperger's kids, and we're getting more and more of these adolescents right now,
yes,
is that they engage, they make an attempt, they so, like you said, they so want to be involved, they so want to be liked, they so want to be accepted by their peers.
Yes.
And most of them are in typically developing programs, schools, college, whatever.
Yeah.
And they try to engage in social behavior, and what happens is they fail. Okay? Just like a sort of a nerdy kid would be bullied, that's what happens to them. They fail miserably. Other children, whatever age, make fun of them. They feel horrible about themselves. They start to develop really serious self-esteem issues.
Yes.
And I am getting a lot of these kids now in high school age years where the parents are calling me and saying, he's suicidal.
Yeah.
He's depressed. He doesn't even want to go to school. I can't get him out of bed anymore. And guess what? Depression is the internal version of aggression. So depression and aggression go together. If you internalize it, you just become depressed, anxious, stay at home, start to do self-injurious types of things, like, cutting, whatever. Or suicidal behavior, actually. And if you externalize it turns into aggression. Now, having said that, obviously there have never been any other cases where we have individuals on our spectrum that have been unusually aggressive. This is not something about our kids. This is about anyone, any individual who cannot be accepted socially. Look at all the other
Columbine
shootings.
kids were not on the spectrum, but they felt isolated.
They were, and it's always about being rejected from society, being bullied, being somehow punished unreasonably. Now, I don't know anything about this shooter's life. I heard something about that the parents had gone through some horrible divorce or something. I don't know. And I don't know what his state of mind was. I don't know what medications he was on. I don't know what relationship he had with his mother, who he shot before everybody else. I don't know, but clearly he had a very, very heightened level of anger that he felt would be resolved by this act, right? So what the connection is, we still don't know. Why he thought that would be the right thing, I don't know. Maybe that was something very important to his mom, and he just wanted to punish his mom. I don't know. But the point is, it has nothing really to do with Asperger's. It has to do with the experience of his life amongst others. And
many factors. Just as you can't point the gun at guns alone and or video games alone. They did say he played violent video games. There's reports of that. And you can't access to guns in the house, inappropriate guns, or to me, and as a mother of sons on the spectrum, would you ever keep semi-automatic guns open to your child?
Well, as a parent, I wouldn't do that, regardless of whether. And I understand that there are, there are gun owners, and but there are lots of children, as was pointed out just the other day, lots of children who are living in homes where they have guns. I don't know about the semi-automatic thing, because I don't get that at all. But children who grow up in homes with guns who don't go out and do this as well.
That's right. So, and that takes me to another, because when this happened, my 17-year-old daughter Nikki was really upset about this. I mean, she was going all over the place, just trying to do whatever she could. She was really upset, and she kept saying, this is why we need gun control. Like, this is why we need guns to be gone. And I said, I disagree with you. I don't think this is about guns. I don't think this is about the fact. I mean, I don't know. In his case, I think he went and got guns. This isn't about control. This is about parenting. This is, here's the thing. You want to own an animal, a pet, you have to go get a license for it. You want to become a driver, you have to go to classes. We're not licensed to become parents. And the stuff that happens, I mean, the vast majority of issues that our children go through, as a parent, we could have either gotten them help or at least recognized the symptoms and told someone. And that's all it is. That's what it's about. It's about or anyone in this young adult's life having said, this guy's really troubled. Somebody should do something about it.
It sounds as though his relationship with his father was cut off for several years after the divorce.
Right.
His mother was keeping him at home. He was not going to any kind of school, any kind of job. They were isolated, the house up on the hill that nobody went to. All of these things are very disturbing because it just shows that there did not seem to be an attempt to incorporate him into the life of the community, his family.
Well, we know nothing about it. I mean, it could have been a completely punitive environment.
Yeah.
We know nothing about this, right? We don't know what this individual was going through.
Absolutely.
And let me just tell you, if you punish someone enough, they will aggress.
Yes.
Period. Anyone.
Absolutely.
Yeah.
So unless you're Gandhi or something,
right.
But I mean, the truth is that his environment had caused a very significant amount of an aversive environment.
Yes.
He was living in an aversive environment. He must have had so much punishment, or his perception of punishment, that caused him to lash out.
Like that. Now, one thing that I did have, oftentimes do you find Asperger's or any autism spectrum disorders commingled with a psychological disorder like a bipolar or like a manic depression?
It's extremely hard. Autism is one of the spectrum overrides certain other disorders. Like, for instance, a lot of people do this and it's incorrect. As someone who diagnoses children, you're not supposed to diagnose something like ADHD if the individual has a diagnosis of autism. It's a smaller diagnosis.
Okay.
So it's like saying you have bronchitis and pneumonia.
All right.
You can't. It's one or the other.
Right.
And pneumonia overrides bronchitis.
Okay.
It's kind of like, if you have autism or you're on the spectrum, we're not really looking to identify something that's a lesser thing.
Right.
But yes, there are comorbidities for sure outside of this area.
Right.
Something like bipolar on its own is hard enough to diagnose. I mean, there's so much discrepancy on how you diagnose bipolar, so that's a whole nother issue.
Right.
But a very common diagnosis with autism, which we just don't do because we feel that it is somehow going to go away if we deal with the autism, is depression, is anxiety. How many of the kids that we have do we see with what we call self-stimulatory behaviors?
OCD, my own son.
OCD, exactly. Well, yes, absolutely, right?
Yes.
And what do I always tell you? Parents don't realize, people don't realize that OCD, obsessive compulsive disorder, where is it classified in the diagnostic book? It is one of the 6 anxiety disorders. It is one of the anxiety disorders. It's very clearly related to anxiety.
Right.
And OCD is one way of controlling anxiety. Depression is another way of controlling anxiety. Aggressive behavior is another way of controlling anxiety. It all comes from back to fear, Shannon.
Yes.
Like I'm always talking about fear. So, there's no tie into actual aggressive types of behavior or other types of things. Really, there isn't.
Okay.
Comorbidities usually are like, you will have certain other comorbidities that are more related to medical issues. Psychiatric, I would say it's probably anxiety is the number one. It's very hard to look at other types of things because you have such a pervasive disorder that it influences all areas of behavior with autism. So it's hard to see other disorders that might exist.
Well, one of the things I think this whole tragedy has done is it's opened up a national discussion about the need for more support with mental health, autism spectrum disorders, the need to talk about how gun regulations might be implemented, and also violence in our culture. Those are 3 very big things that have come out of this. I want to just say how important it is, Doreen, and I know you can reiterate on this, to get the proper diagnosis for your child, because therefore you can find the proper treatment. Is that not correct?
Absolutely. So important.
So don't just guess. Get a professional to get an assessment and a diagnosis.
Right. And I often, when I diagnose and I meet the parents for the first time, one of the first things I'll say is, I don't really care about the diagnosis per se, but it is extremely important because it's the door to funding and intervention, right? I don't believe in labels. I just don't. Especially with autism, I don't believe in these labels. But unless you have that diagnosis, nobody's really going to know what to do.
Right.
And going back to this individual and what happened here, if if we really want to do something, okay, in scenarios like this, and in all of the other ones, the only common factor that I see with all of the other shootings and horrible things, except for terrorism, which is a whole different function, but these types of things, the individual that does the act is troubled. Okay, if I want to tell you as parents or people all across America you could do something, just reach out to someone in your universe that you feel is so troubled that they're isolating themselves. Because let me tell you, when you isolate, the very next thing you're going to do is something that is pretty attention seeking. So if you see people, if you know people who are not socializing anymore, who don't talk about things, who are acting odd, who are angry unreasonably, who are really depressed, who are really anxious, you know, go to someone that cares about them or talk to them and try to just make one attempt, even if it doesn't work.
I think that's so important.
Make an attempt to get help for that person.
Yes, that's something we can all do. And I also want to say that there are grants available through Act Today for children with Asperger's that are having issues that perhaps social skills classes. We have helped many children that have been diagnosed with Asperger's.
That's right.
It's important to know help is out there.